The morning dawns brightly at Kilimanjaro Christian Medical Centre in northern Tanzania. The sounds of the hospital's choir ring out, offering inspiration to staff and patients. It's also the start of a long day's work in the burns unit, where the UK team is working with local medics, treating severely injured patients and passing on skills as they go.
And this is the gentleman with the arm.
At the helm, plastic surgeon Jeremy Rawlins, who flies in each year from his base in Western Australia. It's he who chooses which patients to treat.
It's about really patient safety, because I would love to operate on all these people and transform their lot in life to some degree, but with the limited facilities, access to blood and so forth, you can't do everything, and so also we have a finite amount of time.
Sadly, burns are far more common in Tanzania than back home in the UK. One reason is the number of accidents that happen in the home from the use of open fires for cooking. Among the patients to receive surgery today, farmer Davis Mari. He's been in constant pain following an electrical accident some months ago.
What are your hopes from the operation that you're going to have today?
The severity of his wounds means they will not heal themselves. As a result, he'll receive skin grafts.
Okay. He's hope that he will be fine and he will be healed. Yeah.
The treatment of burns has been a key part of the Northumbria partnership with this hospital for some time. The link enabled the establishment of this dedicated burns unit and sees staff coming back year after year. This is the third working visit to Tanzania for Sophie Robson and Emma Forster. They're specialists in this type of care, usually working at the Burns Centre of Newcastle's Royal Victoria Infirmary.
Yes, absolutely.
It's just an amazing experience. The people, what you get to take back to your day job with you as well, the opportunities that you see, the complex injuries that you might not see as often in the UK, but most of all the people and what you can bring to them, but also what they can give to you, and the feeling as if you're helping them and making a difference really, and they're so appreciative of what we are doing. So it's an amazing thing to be part of.
How can your experiences here benefit your patients when you are back home in the North East?
Hopefully my knowledge is better. I would like to think it is. I feel like it is, so I feel like I'm probably a better nurse all around. I feel like I'm probably a bit more prepared in myself, a bit more sort of conscious of what I do, a bit more confident. So hopefully they see the impact of that in the way that I treat them.
In theatre, preparations have begun to operate on Davis, the young man who was seriously burned. Working together, this international team aims to transform his chances for the future.
He should heal, and he should be able to return to his work, family, etc., etc. So that's what it's all about.
And by training the next generation of Tanzanian surgeons, the aim is to help many more burns patients.
Not only am I doing those surgeries, but actually the registrars that are local to here in Tanzania are doing those alongside me, so that when I'm not here, they are upskilled and empowered and enthused to do those same operations when I'm not here.
The next day, we went back to the burns unit to see how Davis was progressing. He told me that while he was still in pain, he was relieved the operation was complete. For burns patients like Davis, there's still a long road ahead. But this unit and the skills developed here offer hope in challenging times.